Hello, I'm Ben of Silverbush Physical Therapy, and let's talk about how to sit. Poor sitting posture, as well as sitting too much at a time, is linked to pain from the neck, to between the neck and shoulders, to the lower back and the hips. So if we can be in better sitting posture, we can help minimize forces on our bodies and the problems that arise from that. During the pandemic, most of us have been sitting more than we were ever used to. And I'm seeing more patients than ever before coming in that have been sitting too much. And that's a real part of the pain and the inflammation that they're experiencing. So talking about sitting posture, we're going to start from the feet and go up to the head of what the alignment should be. So we're going to want to have our feet flat, our heels level with our toes, so we don't want to be sliding too far forwards or too far back. So something like this. You're going to want your knees and your feet to line up, so your knees should be a roughly 90-degree angle there. As far as the hips go, we don't want to be leaning forward. We've all done too much of that. We want to try to keep our pelvis, our hip bones in a neutral posture. So something like this. Basically flattening the small of the back but maintaining a little bit of an arch. I'll show you how to do that in another video. We want to keep our hips about hip width apart, and we want to keep them angled a little bit forward and downwards, roughly at a 20 to 30 degree angle. That'll help minimize some forces. We also want to try to relax the muscles between the sit bones. A lot of people have been tensing those too much. Something else that can help with this posture when you're trying to be in this neutral pelvis is to use a cervical or lumbar roll. You can place this roll behind the small of your back to help out with alignment. You can also place it kind of by your sacrum or your sit bone there. So you could also even place it a little bit higher up the back if that'll help you at a given time of day. But this is just a tool that can help you be in posture longer, especially as you're trying to build up the strength of these muscles. All right, so next, you want to make sure your forearms are roughly at a 90-degree angle. And you want to have your shoulders back. So we tend to keep our shoulders rounded or protracted. We want to try to keep them back like this. And you also want to try to keep your ears over your shoulders. And if you're like me, my head's ahead of my body. This is how most adults are over the age of like 20. We want to try to keep our head more back. So an exercise called chin tuck, something like this, can help encourage that posture to just have more lasting power. And as a final tip, no one's going to keep their self in perfect posture all day, certainly not physical therapists. So we do want to try to vary our posture. Like we mentioned, it's a good idea to get up every 20 to 30 minutes and stretch out a little bit, but it's also good to simply change our position. And when I talk about varying posture, I'm not saying it's okay, it should be like this a good part of the day. If you have to for a moment here or there, that's okay. But in general, we're trying to keep the pelvis as neutral as we can. Maybe we'll shift it a little to our right or a little bit to our left, that sort of thing. So those are my tips. Thanks for watching, and I hope this was helpful.